Did you get a good night's sleep? A new study suggests the better you sleep, the longer you might live. Makes sense, right? But it went a step further, looking at a number of sleep patterns that could impact your lifespan. Devin Haskins is live in studio with us this morning. And Devin, I think all of us could use a little bit more sleep.
I don't think there's any problem with that one. As adults, they say we should all be getting around 7 to 8 hours a night. But are we actually getting that? I mean, last night, probably closer to 6 for me. This study suggests that it's more than just the length of sleep that you get, but 5 factors that could help extend your life.
How many hours of sleep did you get last night?
I got around 7.
Dr. Frank Chin with Beth Israel Deaconess Hospital in Boston is the co-author of a study looking at our sleep patterns. Researchers took the answers from a CDC health questionnaire and studied more than 172,000 respondents' answers from 2013 to 2018. The questions were about our sleep patterns and not just about how many hours a night we get.
The reason we did that was because right now the main recommendations for what we call healthy amount of sleep is only looking at sleep duration.
The study focused on 5 different factors of sleep. 1, how long have you slept? 2, did you have difficulty falling asleep more than twice a week? 3, were you able to stay asleep? 4, did you have help like using sleep medications? And 5, did you feel restful when you woke up at least 5 days a week? Each factor was assigned either a 0 or 1 for a maximum of 5 points, which indicated the highest quality of sleep.
And essentially what we found was all of these factors are independently related to mortality.
The more factors you met, the lower your risk of an early death. Fewer factors, the greater your risk.
Someone who has 5 factors is having much lower rates of mortality and longer life expectancy than someone who has maybe 0 or 1 of those factors.
So how much longer? Looking at the death rates of some of the respondents, some of who actually died during the course of this survey, they found that for men, life expectancy was almost 5 years longer. For women, it was closer to 2.5 years longer.
You know, if I had to take a guess at why that might be, one thought I had was perhaps that, sleep disorders like sleep apnea is just much more prevalent in men. The other thing would be perhaps women on average have a higher life expectancy than men.
All right, Dr. Chin says it's never too late to start trying to get better sleep. He does admit, though, more research is needed. This was an observational study of the answers that were given. Just hopes the doctors, again, take the time to talk to their patients about their sleep habits.
Yeah, important.